Hi, my name is Emily Davis. I was diagnosed with stage 3 breast cancer on April 11, 2014 at the age of 29. I went in, one night I was getting out of the shower and I felt a lump in my breast. The reason I felt was because I was having some pain, and I went to go feel to see if there's anything that I should be concerned about, and that's when I felt the lump. The lump did not feel like you would typically expect, like a ball in there or anything. It was more like a hardened area right up under my skin, about the size of a lemon. The next day I called the doctor and I came in, saw her, and had a mammogram done. It was probably not even an hour after I had the mammogram. She called me with my results and she told me they were abnormal and that I needed to see a surgeon. The next week I saw the surgeon, had my biopsy, and then 2 days after the biopsy I was diagnosed with breast cancer. It was not even an entire week after that I went in for surgery. I had a double mastectomy and the removal of my lymph nodes because 2 of them were positive. I had like 2 or 3 weeks from surgery, and then I started chemo. My chemo started at the beginning of May and lasted till the last week of August. It was rough, but I kept working and that kept me going. And my children were 2 and 5 at the time. My oldest was starting kindergarten. And I remembered I had purchased them books off the internet. They were picture books about a mother that was diagnosed with breast cancer and what to expect, and showed her the process of losing her hair and wearing these scarves on her head. And I think that helped a lot with them and understanding. And I tried to tell them that the medicine that I had to take to get better was going to, lose my hair, and they even helped shave my head in the process. I think that helped a lot. Then I had chemo until the end of August, and during the whole time I actually worked, and I tried to do as much as I could with the children to keep things normal and what they were accustomed to. About a month after chemo ended, I started my radiation treatments. Ironically, my first radiation treatment was October 1st, Breast Cancer Awareness Month. And so, of course, I walk into the cancer center and the entire place is decorated in pink, and the Today Show was talking about breast cancer awareness, and it hit me like a ton of bricks. And I was like, this is going to be my life now. Once radiation was finished, I was done with treatments, except I do have to take a medication every day. The medication I'll take for the next 10 years at least, and other than that, I'm finished. The past year I've been working on my reconstruction. It's still a work in progress. I'm still working on it, but I'm thankful to be here, and I know there's a chance of it coming back, but I stand strong in my faith. I live life day by day, and I know He'll have my hand in this no matter what. And I'm thankful for the support that I had throughout the community and my work and my husband's work. We had lots of support, and I thank everyone from the bottom of my heart. My main purpose of sharing my story is to let you know that cancer can happen at any time to anyone. I was in my 20s and had no history of cancer in my family. And, the common misconception is if it's caught, if you're early or if you're young when it's caught, then it's mainly a hereditary type cancer, and mine was not. So it's still important to do self-breast exams and have mammograms done. I also, for months before I was diagnosed, had symptoms of cancer. And at the time, I did not think that it would have been cancer, so I kind of brushed it off and, went on with life. But if I would have been doing the self-breast exams then I probably would have felt the lump then and could have gotten help sooner. So it's very important to listen to your body and to know your body, and if there's any changes, to go to your doctor. I'm sure that they will order a mammogram, and I'm very thankful that day that I saw mine, that they had and ordered my mammogram. Thank you.